And exhale, easy. All right, now I'm gonna wait for her muscles to let go. They're right here, good. Okay. Ankle dorsiflexion, so there's not a lot of shear force. All here, there, perfect, good. Okay. Hey everybody, this is Dr. Warren with the star of UMBC soccer right here. Collegiate soccer player and also trainer extraordinaire in our office with 2 cases, not one, of some Achilles tendinopathy and a little bit of tearing in there too. We just got an MRI on her feet and her ankles, and you've used your feet a couple minutes here in the last 6. That doesn't even make sense. She's been on her feet a lot. You've been running a lot in tight shoes, and because we should just restart this, but we're not going to. We're just going to keep on going. So tell me a little bit about your history with your feet and your ankles, and then kind of your relationship with us in the office as well as coming in as a patient now.
So, I mean, I've been playing soccer for 13 years, so they've had wear and tear.
That's what I was trying to say.
Yeah.
Thanks.
Welcome. So I'm on them all the time. And then I came into the office as a patient and then started being like working on the floor and coming in as working as like
An employee. / intern.
Yeah, / and so I was standing on them for 5 hours, 6 hours at a time on top of training and everything. So feet are kind of taking some tolls, I guess.
Yeah, we're giving some TLC to the feet.
Mm-hmm.
Right? So big story here is that we got an MRI of the feet, and she's got a 5 to 6 centimeter interstitial and tear in the tendon and muscle junction, and towards the insertion of both those Achilles tendons. And with that comes the pain, with that comes the use. She's not out of soccer, she's playing through it, and we're giving her supportive care alongside of what the ATs are doing at school with her, which is a lot of rehab and exercises. So in here, she just had class 4 laser done on both tendons. How do you like that?
It's good. I noticed an improvement from the very first visit, like on Monday. I was walking around and running a lot better.
Good. It could be that quick with laser therapy in terms of the pain management.
Yeah.
We still need to work that tendon. We still need to work that tissue. That's where we're going to do some focused ART on her calf and her Achilles tendon. Cool. Where are you from?
Canada.
Yeah, you are.
Toronto.
Cool. Yeah. Come on in and get comfortable. From Canada, from Toronto. Soccer background there, and then she got really involved with this past summer, right?
Mm-hmm.
Yeah, tell us about your internship you did when you went back home.
Oh, when I went back home? I was working as an on-field medic for youth soccer, so I was coming on to the field and like being essentially an athletic trainer for a bunch of 12-year-old girls who
played soccer, right?
Played soccer as well.
Was it a soccer complex? Was it a soccer program that you were working with?
Yeah, so I was working with Ontario Soccer Association. They have a rehab clinic.
Yeah, that's so cool.
So I was able to reach out to them and get trained up and be able to support the youth soccer the same way I've been able to support it as well.
So, experience as well. Did your experience here help you out in landing that spot at all?
Yeah, for sure. Because I mean, they asked me like what I've been doing and my knowledge and everything, and being here, I was able to sort of understand the basics of like how the body works and what helps in certain situations, and getting like the terminology from like a more scientific and like anatomy standpoint.
She got reps.
Yeah, that's pretty cool.
Yeah. So being able to help that way and like learn here and sort of like apply knowledge from school here and then be able to then apply it at home was good too.
She's very passionate. Okay. She's got a big heart, and she's really willing to serve. She works really hard. She came in here with that mindset, without a ton of experience off the bat, and because of those values that she carried in here, she was very successful with helping starting with fundamental rehab and PT exercises, and expanding her role and skill set to really doing some advanced strength training with patients that are in more of the functional strength program in our office. So we combine fitness and chiropractic here, we combine fitness and physical therapy here, and she was a pivotal role early on as an assistant here doing that. Then she goes and she must have been, you are a sophomore last year, right?
Yeah.
You're a junior this year?
Yep.
So she's passionate, but she's also hardworking. She's willing to put in time outside of school to get the experience to allow her to have that in her summer of her junior year. So if you're passionate, you're hardworking, and you've got good values, and you put yourself out there, and she's talented too. So like I truly mean that. I would say this to your face and not your feet. Just want you to know that. So it's been fun to get to watch her progress through that process as a collegiate D1 athlete, and still get the experience in here too to open up more doors for her. And so with Megan, she's got a open door to come back in here and work here. Hopefully this upcoming spring we'll see what the schedule allows. And you know, she's talked about wanting to become a chiropractor, and I really think that if I can be in any manual therapy or any physical medicine role that she chooses to go down and be a part of, I'm really excited to support her in that process, because she's going to help a lot of people. A lot. What do you need to do to make the biggest impact on the most amount of people? Me being a part of people like Megan's lives I'm grateful to have that opportunity, and I think that holds true to that statement right there. All right, let's talk soccer.
Okay.
Let's talk it. So a lot of sheer force put through the heel and the back of the leg, and even the upper back as well when you're hitting and running the way that you do and exploding through the ball the way that you are on a routine basis. So the tendon and the heel take a lot of stress, right? And sometimes a tear can be in a moment, or sometimes a tear can be like this, okay? And most of the times, we'll see the latter, okay? All right, we're gonna get right to it now, okay?
Mm-hmm.
Point your toes to me. Toes to your nose. Good. Keep going, keep going. Toes to me. I'm gonna block you. Push. Toes to your nose. Painful, I know. I'm using a lot of force down there right now. And right in here is when she'll get a little bit more sensitive. I gotta be mindful in that area. Not to overdo it, she'll guard a lot more afterwards if that's the case. Okay, toes to me. Good, now toes to your nose. Toes to me. Push, push. Atta girl. Good, relax. Good, let it go. There you go, good, good relaxing. There it is. Toes to your nose. Good. You feel how I found that little line right there?
Yeah.
There it is, good. Toes to your nose. Sometimes you gotta be patient to get that sensation underneath your hand. Get that end feel. And now I know exactly the line of tissue I want to work. Right there. Toes to your nose. Awesome. Go, 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 go. Push. Good. Alright, good. So this, coupled with laser, we're going to adjust her midfoot, her knee, her low back. Make sure everything is moving well and swimmingly. And supportive towards good ankle dorsiflexion, so there's not a lot of shear force. As much shear force put on there, she's moving well through those mechanics. Relax your shoulders. Good. And I just know soccer players, it's right here, because that's where they hinge off of. Now I want you to look forward, rest your chin, deep breath, and exhale, easy. All right, now I'm gonna wait for her muscles to let go. They're right here, good. Okay. On to the other side, I should say. Okay, point to me. Toes to your nose. Good. Would you go to chiropractic school in Canada? Or would you go in the States?
Honestly, up for anywhere.
Yeah.
Chiropractor school at home is great. Like.
Yeah, there's some really good schools in Canada.
Yeah, and I think that like it's overturned sometimes, but
Sorry, yeah, talk through that right there.
But honestly, I would be open to see any schools. I like the idea of being able to see the world through school or like through soccer. So
Yeah.
that's why I'm here now.
Well, you want to go to school in Italy?
And that'd be pretty sick.
Well, that'd be cool. So I had this opportunity lined up in Murcia, Spain when I was getting ready to come home. And it was a preceptorship with a sports doctor out of southern Spain. I don't speak Spanish, but I speak enough to be say aquí. That's not even good. But like I would work hard to make it happen if I got that opportunity and went forward with it. But instead, I went to I worked in a hospital for 6 months in DC instead. But you can travel the world through chiropractic for sure, and through school, like you said, right? Is that kind of how you ended up here?
Yeah, I mean, everybody at home like kind of stayed at home and stayed in and around the area.
Yeah, sure.
But the idea of being able to go to school elsewhere and like see the rest of like, I mean, it's Baltimore and it's Maryland, but it's still, it's new and you're seeing new people and meeting people from all over the world through soccer and school and everything.
That's awesome. Point up at me. Different muscle. And down. So when I get to the soleus, Megan, I bend the knee. It shortens up the gastroc even more, allows me to get more depth. I can get to stuff like that. Good. And relax.
Hands are
I'm
tired.
shaking my hands out on you. These guys are strong, girl. Want to be? I've had like 4 or 5 cases of Achilles tendinopathy come in this week, and this is I don't know if there's a stronger tendon in the body. I don't think there is.
You know what's so funny? I literally just watched Troy, which is about Achilles.
Brad Pitt in that movie?
Yeah, I literally just watched it, and it's so crazy because I was like,
Such a good
the
movie.
second you said that, I was like, oh my god, what are the odds?
Toes to your nose. That's what it is. Everyone's been watching Troy lately and
It's a good movie.
been hurting their Achilles tendons.
Right. Is that what happened to you, Megan?
Yeah, you know, I just started watching Troy.
Yeah.
You just been watching Troy on rerun for the last 13 years?
I'm crying. That's funny.
Toes to the nose. Good. There you go. And relax. Toes to the nose. Point at me. Good. I'm going to block you. Point harder. Good. And relax. There. Good. Now toes to the nose. Now we're gonna. I know PTs are watching me and chiropractors want to like just use a Graston tool or use a soft tissue instrumented tool. There's nothing that replaces the feeling of touch. I'll tell you that. No robot, no tool. So I just feel better with my hands. I get more feedback. I know what's going on a little bit more underneath. People palpate through their tools though. It's still good and effective. Maybe it's just I'm not as trained in it. Not as privy to using it. It's not my dogma. Point at me. Toes to your nose. Okay, relax. Alright. Come on your side, facing them to your left. So, yeah, motion palpating our low back and pelvis. Feeling restriction on this left lumbar sacral area. And we're going to adjust your low back. She'll move easy just like that. Good. Take a breath in. Give me a little shimmy in the shoulders. Let it settle. There you go. Good. Good. Perfect. Come on your back. Do me a favor.
Mm-hmm.
Grab me a piece of tissue paper behind you. I'm gonna fall into the wall because I made it too slippery. Okay, good. I'm gonna need another one in a second, Cal, just so you know. Nice skills, Gabriella.
Multitasking.
Oh, holy smokes, you're fantastic. Toes to your shin. Good. And relax. Easy. Good. So cuboid adjustment on the outside here. Remember this one?
Ooh.
You see how it's isolated just to that joint when you do that?
Yeah.
There's a lot of joints in the foot. I'm pretty proficient as an extremity adjuster. You can make a lot of things happen for people's feet. Plantar fasciitis, dorsiflexion issue, there it goes. Achilles tendinopathy, Morn's neuroma. Those are kind of like that cubital tunnel syndrome. Tight toes. Always the tight toes. Stop watching Troy so much, okay?
It's actually just still playing on my laptop.
Turn it off. We're done this leg. Who's your next opponent?
We're playing Bryant on Sunday.
Bryant?
Yeah.
They have a good lacrosse program.
Yeah.
All right, hands here. Look. Turn your head to your right. And check your first rib on your left-hand side, okay? Reach across, hold on to my back. Easy, loose. So this is a really fast way to palpate upper thoracic spine and ribs. I'm feeling underneath here to see how the feedback is from the table underneath my hand. So it's this, AC, humerus, first rib. Good. Turn your head to your left. You move well here. Hold on to my back, I'm just checking a little bit more lower. Good, relax. Yeah, that's fine. That's good too. Cool. All right. Smooth, okay? Easy release. Good. Let it go. There you go. Fall here. There. Perfect. Good. Okay. Good?
Mm-hmm.
Awesome. Come on your side, face this way. Rest here. Give yourself some love. Okay. Settle here. A little more to go. There it is. Good. On your back. Cut. Huh. Little pattern to that. Midfoot, right, knee, here. Last time it was to your cuboid, your right SI. A bit up to your shoulder, but not as much. So there was restriction on the right SI joint, right fib head, right midfoot, and mortise joint. So, something to think about. As you're balancing through like single leg squats, make sure you're as even over here on this left hip. Challenging that area just as much. What footed are you?
Right footed.
Hold that maybe a bit. Loose. Awesome. Okay. All right. So this is the second session.
Yes.
Beautiful. You had a good response the first session. It's always a good sign. We're going to keep moving forward, make sure that we're not plateauing. We challenge you a little bit more, make sure that they're challenging you with PT a little bit more through the course of it.
Mm-hmm.
Thanks. Appreciate you. Thanks for watching. Achilles tendonitis, tear, video, Megan, elite human being. And yeah, hope you learned something.